So we were expecting to have a first appearance of our interim dean, Joel Kaufman, this afternoon for this town hall meeting. But unfortunately, Joel had a medical emergency this afternoon. And so our thoughts and prayers are with him. We believe he will make a full recovery, and we will reschedule the main part of this meeting for when he can be here to talk about his vision for the school and some of the recent accomplishments of the school. But there was a part of the agenda that we really thought was very important to keep today, which is the opportunity to hear a little bit more about the Population Health Initiative. We're so fortunate to have the project director of that initiative here, Derek Fulweiler, and we also have a number of members, including the student member, of the Executive Council for that initiative, and jointly they will be prepared to answer questions to the extent that they can, because this is still something that's evolving. So if you would like to move forward to so that you can hear better and you can ask your questions more directly, then I encourage you to do so. And I'm going to hand over the podium to Derek Fulweiler, who will share kind of an overview of the initiative, and then we'll take some questions and we'll have the panel take their seats at that point. Thank you.
Thank you. When I was first asked by Joel to speak, he'd said, could you come on up and give a 2 or 3 minute introduction, and then we'll go through about 10 minutes of questions. So now I've been asked to make sure that I talk long enough so that by the time we finish in here, the food will be ready outside. The good news is this is such an interesting topic that I imagine that there are going to be quite a few questions. So looking forward to getting to those in a few minutes. So the Population Health Initiative. I know this is a topic near and dear to many of your hearts, so please bear with me if I'm repeating things that either you've already heard me speak about or Mary Moke, our Vice Chair, speak about. Number of different ways to look at the health of populations. Institute for Health Metrics and Evaluation, which is here at the University of Washington, one of the ways that they look at it is in terms of life expectancy. So this is a graph from their global burden of disease, and you can tell based by looking at it that you've got quite a big range in terms of life expectancy when you look from North America moving your way across. You also see quite a bit of differences in terms of life expectancy within the U.S. itself. So you can see kind of on the low end, we've got about 72 years on average, up to the high end of about 84. I should probably clarify, this is specific to women. And then drilling down to King County in Seattle. So based on IHME data, we can tell that there can be actually up to a 15-year life expectancy, a difference in life expectancy within King County based on the neighborhood in which you live. Last spring, President Katz brought together the University of Washington campus and said, you know what, this is only one metric, but this is appalling, that within a region as economically robust as ours, you can see still this type of range in terms of life expectancy. So that was, again, not only the only metric we look at in terms of health of populations, but certainly a significant one, and that was one of the reasons this initiative came about. So, as Judy Wasserheit has pointed out to me a number of times, there are a number of different definitions of population health. A lot of different perspectives. One that we take a look at is the health outcomes of a group of individuals, including the distribution of such outcomes within the group. So this was originally put forward by David Kendig back in, I believe, 1997. He first kind of introduced the concept of population health and then really defined it in 2003. So most importantly, though, he introduced the idea that population health is just not about the absence of disease. It's also about all these other overlapping, intersecting factors. So again, introduce that concept of intersecting and overlapping factors. So you cannot rely solely on a nurse, a doctor, others within a health profession to make us healthy. So the initiative itself, President Katz last May 3rd, said, improving population health is a moral imperative for the University of Washington. She convened this as a presidential initiative. She said that this is part of our service to the greater public good. So through this initiative, she said, we're going to go ahead, we are going to create a 25-year vision for advancing human health and well-being worldwide, not just here locally, not just regionally, not just nationally, but worldwide. And also importantly, to build upon what we already do very well, to then expand the impact that we can have across the world. So really trying to find ways to take the data from the Institute of Health Metrics and Evaluation, the other data we have from folks like the eScience Institute, biomedical informatics, clinical informatics. We've got all this data that tells us where the problems are. So now moving forward into how can we impact human health and well-being through policies, reforms, interventions, innovations to truly make an impact, which was a topic that President Katz hit again yesterday during her annual address. How do we as the University of Washington make the biggest impact possible? So touching again on how do we see population health, we've specifically and purposefully kept the definition quite broad. So again, it's not just the elimination of diseases and conditions, disabilities, other afflictions, but also addressing those intersecting and overlapping factors. So that's everything from climate change to poverty, issues related to urban planning, racism, healthcare access, healthcare quality, governance, public policy, all of those things looking together to try and improve human health and well-being. So one way that we kind of categorize this, because this is a pretty heavy lift, around three major pillars. So human health, environmental resiliency, and social and economic equity. So you can see how particularly those perhaps on upper campus who traditionally haven't thought of themselves maybe as working in the area of health, how their work, how their research can intersect with this umbrella idea of population health. You can also see how, based on this broad definition, this collectively can affect the lives of, or does affect the lives of billions of people around the world when you think through each of the different pillars. So in terms of how we've organized the initiative, in terms of an initial way of thinking through it, taking a look at 5 key areas. So the education and capacity building is what are the degrees, the majors, the minors, the electives, the certificates, the things that we can do as a University of Washington to make sure that we are preparing the next generation of not only researchers, but also folks who are going to go out there who may not pursue a career or profession in population health, but to make sure that they go forward having an understanding of how all of this comes together. Also taking a look at diagnostics and critical assessment. So this is kind of your big data piece. So the data you saw from, say, those slides from Institute for Health Metrics and Evaluation that I showed you at the beginning. But also the iSchool, clinical informatics, biomedical informatics, the data visualization we see through the eScience Institute. Developing and testing innovations. So once we have identified where the challenges are, how are we going to figure out what the best way is to move forward? So there's going to be trial and error. We know that we will go down the wrong path at times, but moving forward to develop those next generation of interventions and innovations that truly are going to impact human health and well-being. Implementation science is the best way it's been described to me is far too often there's very promising research that goes out in journals, and too often it goes up on the bookshelf, not to actually be implemented into practice. So what can we do as a University of Washington to speed those innovations into practice so that we can get care and other factors related to population health into practice quicker, faster, more efficiently? And then that last bucket is strategy and planning. So your public policy, your governance, your regulations. So once you've got something that is proven, this works, this is the way forward, how do we make sure that it's institutionalized, not just here but around the world? So in terms of a few things that we're doing now as we start to get this off the ground, we're in the midst of trying to figure out what is that 25-year vision that we're going to pursue. So that's work that's underway this fall. Many of you in the room, I think, have probably had a chance to respond to our visioning survey. We've certainly seen great input from the School of Public Health, not only in terms of ideas around what should the vision look like, but specific challenges that we can take on, specific projects that we can use this particular initiative to help advance human health and well-being. So this work is being driven by an interdisciplinary and tri-campus executive council. So there's several of them are in the room here. I think that it is quite clear when you look at the makeup of the council just how important the School of Public Health is to this particular initiative. I think it was 6 of the 29 council members either have a direct connection to the School of Public Health or have adjunct status. We're also making sure that we reach out to folks who are not included on the council, making sure that all perspectives are included, not only faculty, but also students, staff, and also around the region. So making sure that we are drawing perspectives from the county, from the state. As we move forward, we're going to be putting together an external advisory board to help make sure that we stay on the right path. Also make sure that we pull in the international, the national, the local experts that we need to develop the innovations, the interventions needed to move this forward. So for those of you here in the room who are students or faculty, there's several things you can do right now to get involved. If you haven't had a chance yet to take the visioning survey, we certainly would encourage you to. You can access that through our website at uw.edu/population health. We're also trying, as part of our initial work, to develop an inventory of what already exists. Because what we don't want to do is create something new when there's already the answer here. So one of the ways to do that is to create a resource directory or an inventory of what we already have. So we've created a website that any of you can go to if you've got expertise in this area, if you run a center, if you run an institute. Very easy, within about 5 minutes you can go ahead and load yourself so that as we look at developing collaborations and partnerships across campus, you have the opportunity to be found, as opposed to the way, unfortunately, sometimes it happens now. It's walking around, maybe knocking on doors, it's a chance meeting at a dinner, something like that. The President and the Provost have also said population health is such a priority. When we're talking grant applications, they'll write a letter of support for you. They're also looking at piloting some funding opportunities right now to get a sense for where is the demand, how do we engage students in this effort, how do we engage graduate students in this effort. And I won't dig too much more into this because I know we've got a mixed audience here, but certainly would encourage those of you who are interested to please take a look at our website to learn more. And then some initial ideas that we've been kicking around, some ideas that we've heard as we've been going around. What can this initiative accomplish? So if we can increase collaboration across the University of Washington, not just the Seattle campus, but the Bothell and Tacoma campuses as well, that is seen as a big success. Creating a hub for ideas to come in, innovations, potential innovations, collaborations to come in. Also, supporting grant writing for innovative ideas. Is there a way that we can connect with faculty to have them offer some mentoring, some guidance as grant applications, particularly from junior faculty, are going? Have them help bridge these gaps in terms of making connections across departments. Also looking to what sort of pilots, what sort of ideas could we start in collaboration with local, regional, national partners. Also, as I touched on earlier, what do we need to do in terms of education to move this forward? So there's so many good things going on. Again, we don't want to duplicate, but are there ways that we can bring different programs together in different innovative ways? And also looking at are there workshops or other things that we can go ahead and address. So that is an introduction to the Population Health Initiative. I would like now to actually invite up some of our Executive Council members who've got School of Public Health connections so that we can maybe dive into some questions you have, comments you have, ideas, things of that nature. So if I could.
My name is Eric King. I am a graduate student in the Department of Health Services.
Hi, I'm India Ornelas. I'm an assistant professor in the Department of Health Services and also the research director of the Latino Center for Health and the school's faculty champion of diversity.
Good afternoon. I'm Judy Wasserheit. I'm chair of Global Health. And I'll stop there.
So if you'd like to ask a question, there's some microphones set up, or you can also just give it a yell.
So I've got a question.
Break the ice.
So many of us in the School of Public Health would really like to hear from you how you can see how we could get involved in the three pillars that you collectively have established as being, how you're going to set this thing up. Because I think everybody is keen to get involved, and they would really like to understand how to get connected and how you see as getting connected with the pillars beyond just signing up on the research resource site.
Sure. I'll go ahead and if you want to jump in. So going back to those three pillars, I would just clarify and say that's how broadly we're defining population health. In terms of what is the actual initiative going to look like going forward, I don't think we quite have that answer yet. We're working through the visioning. As you can see here, some of the low-hanging fruit, a number of different ways we could potentially structure it. So could we potentially tackle some grand challenges around different topics? Is it about making sure that the infrastructure exists so that anybody with interest in population health has an avenue through which to put out new ideas, new research projects? So in terms of the actual engagement, I would say if, as we've kind of made the tour, Patrick Haggerty is sitting up front. We actually just were in a meeting with the Department of Biostatistics last week. If you have ideas, if you're interested about collaborating as we work through this, if you'd like to just learn more or ask some questions once you've had time to think on it, please reach out. A big part of what we do is making sure we go out and listen, kind of a listening tour, figure out what is out there. And if we aren't hearing from you, we don't know everything that's there just because the entire university is so massive. Does that kind of get at your question? Did any of you want to add to that?
I'll just say that in the few meetings that we've had so far, we have been talking a lot about this idea of what are the grand challenges, what are some really big problems that we think we can tackle with this initiative, and spending time prioritizing it, talking about how different disciplines view population health and how we can come together. We are really anxious to actually see, as the Executive Council, to see the results of the survey and see what all is going on, and encourage you to let us know through the survey or through one-on-one conversations. I think all of us feel very open to hearing from anybody in the School of Public Health, today especially, but in other forums, what you would like to see included. And I know that there'll be lots of opportunities to be a part of it. I think we all very much feel like we are just getting started.
So the way I would think about this initiative is that this is an invitation on the part of Anamari and more broadly the leadership of this university to help make this university and this ecosystem for global health and population health the go-to place, or one of the go-to places on this planet for population health education, training, and research. That's really kind of where this vision is trying to take us. And it's pretty clear that if you look at those three pillars, this school is pretty central to moving forward. I think at this stage, this is very much a work of art in progress. It's unprecedented to try to put together a 25-year vision for something like this. This is audacious, this is big, this hasn't been done before. And so it's not like we are at a stage at which we can say, okay, here are the three steps moving forward. I think that the most important thing right now for all of us in this school, and actually more broadly in health sciences, to do is to provide input to Derek and to others about what would be necessary to actually move forward in that space. And there's a tricky piece here that we've been struggling with a lot. On the one hand, we want this to be really broad and inviting across the entire university. On the other hand, if it's too broad, it becomes so unfocused that we don't actually get anywhere. So that's where those three pillars come in. They're pretty broad. If you think about health and environmental resilience and social and economic equity. Those are all essential to population health and well-being, but that includes a lot of us, both on upper campus and on lower campus. So right now, and Derek, you can contradict me if you disagree with this, but from participating in several of the working groups, my sense is that what would be most helpful would be to hear back from all of you and all of us about what it would take to actually move forward. And we're not going to do all of this in the first year or even the first 5 years, but this is potentially huge, and it's a great opportunity for the school. So,
Do you want to say about how you're engaging students? Yeah.
I just want to add one more thing to what Judy said. So in addition to education, research, and training, I think something else that we're trying to focus on is impact. And this was mentioned in Anna Mari's address yesterday. And this is something that I see at the table a lot, is this sense that we want to publish but not necessarily do something. And that's a big frustration of mine as a student, and I think others are recognizing that. Definitely trying to get input is important. After this, I'm speaking at the GPS Student Senate meeting, trying to engage more students and hear what they want out of this initiative. It is really big, and sitting at the table where, like, what does this look like? We all just kind of look at each other. We're like, well, I don't know, what does this look like? And it really takes the conversation and more voices being heard. So, and I wish I could give you a beautiful explanation, but we don't have it yet. So we definitely need your input.
I'll just add one more thing, is that this really is a great opportunity to think out of the box. And that's been a really fun part of some of the meetings that we've had already, where a lot of people are saying, this initiative needs to be business, not as usual. And you might have seen that some of the materials talk about this initiative being disruptive, which is great, I think, because we want to think about things that could not be funded, could not be done at this university any other way. And so please do send your crazy ideas, send your crazy and good ideas.
So Aaron Katz, I'm in health services. So maybe this is a good segue, India, from your disruptive suggestion. I mean, it's sort of typical for a new initiative to want to go after low-hanging fruit, and it makes sense. You want to have some early wins. But let me suggest that there's a high-hanging fruit that I think you ought to be reaching for. This is a very ambitious initiative. One of the most difficult things for an initiative like this is to look inward as opposed to outward. Universities would tend to be good at looking outward. We do research, we send it out, we send our students out, etc. But it seems to me in this arena of trying to affect population health, we ought to really be looking at our own community and our own behaviors and how they affect the health of our main constituents, our main subgroups, faculty, staff, students, the communities that we live in, and particularly this state. Do we treat people equitably at this university? Are there people that are disenfranchised within our own communities? How does the university behave in the state's political system? Do we support efforts to make our tax system more equitable? Do we support efforts by the state to reduce inequities in not only health, but more fundamentally, income and wealth? And so I guess I would urge the initiative, and we should all be part of this, right? That's how you'd feed back to me. But to really look at this institution, which has a huge amount of resource and affects a wide range of people and could affect the whole state, and obviously globally great too. But I think, I never thought I'd say this in public, but to echo something Donald Trump said in an interview about foreign policy is, before we tell other countries what to do, we ought to get our own house in order. And we have a lot to get in order from the top down at this university. So I would just encourage the initiative to grapple with that high-hanging fruit of reflections on our own behavior.
Yeah.
I just want to respond to Aaron. I agree completely. And this is something that I feel keeps getting brought up in the meetings, is that this is a state institution and we need to focus on our local community. And I'm all for going to developing countries as well, but we have huge disparities in Seattle. And no, we don't treat people equitably here in Seattle, in this institution, within this school. And we all know that. And that definitely needs to be addressed. And the initiative is trying to, but we also need you to help us as well, because this isn't just the 26 of us on the panel, it's everyone. But I completely agree, and yes, the voices are that's definitely being addressed.
I'd like to respond as well. I actually think, I don't agree with you. I agree with the notion that we definitely need to look at what we're doing internally and pay attention to our communities in the city, in the state, right here within the university. Where I don't agree is your statement that universities, including this one, tend to be very good at looking outside. I actually think that we tend usually to be very poor at looking outside the ivory towers. And that in addition to all the points you made, which I do agree with, we also need to look at the outside and what the needs are outside, not just locally, but globally. So it's yes and. What I don't agree with is just stopping with the one piece.
Hi, Nadine Chan, an alumni of our Health Services PhD and MPH program, and I'm currently the Assistant Chief at our local Public Health Seattle-King County Health Department. And thank you for working on this very bold and audacious initiative. A couple of comments I would like to make. One is, if we're really vested and interested in this 25-year vision to improve population health for the communities and populations that disproportionately experience inequitable health, in your list of folks that you're going to solicit information from or to get engaged with this project, it was hard for me to see where those populations, the real people, fit into that timeline. It might have been in there in our community partners piece, and maybe it was a little buried, but I think calling that up front and center is important. Thinking about internally within our school and academic, if you're putting out there that we want to be the global leader in how we train people to work on and be successful in improving population health, then how are we applying that as a criteria to prioritize who is coming in as students? Are they coming from those populations, those communities? And thinking about not only the data that tell us where the problems are, but what about the data that's telling us what's working well in some communities but not working as well in other communities? So thinking about, we're really great at tracking health outcomes and individual level data. We have set up our surveillance systems to do this and do this well. What we have innovative, I think, is to think about then how do we set up similar systems to track our policies and our institutional practices, whether globally or within our local settings. If we know that education is a path out of poverty, and we know that schools in some school districts are better than other schools in other school districts, well, why is that? Are there policies that we could be tracking over time and comparing to see if we're doing a good job in places where those policies are not doing, as good or serving the people as well? And what is the surveillance system for that? So those are my comments. Thank you.
Thank you. Those are great points. I would say, and three of you can jump in. Based on some of the conversations we've had so far in these small groups, you hit on just a number of things. Defining our communities, making sure we define what we mean by communities, making sure that we have evaluation in place, and also, actually, just as an aside, Dr. Moke and I are actually coming to meet with your director and chief medical officer on Friday, just as an example of trying to get that sort of engagement. So did either any of you three want to jump in and talk more specifically?
Yeah, I was just really glad, Nadine, that you brought up the issue of creating a diverse workforce, and I think that's something we've talked about a lot, trying to integrate some of what we're trying to do around diversity anyway within the School of Public Health, and also more largely with the Race and Equity Initiative of the university to both increase diversity of faculty. If we know we want to teach things like racial and ethnic health disparities and community engagement, our faculty needs to represent that and look like the communities we serve. And so thinking about how Population Health Initiative can help us further those goals, and thinking more explicitly about the training that we provide to people, and even, as you mentioned, things like the students that we're admitting. So I really hope we can tackle a lot of those goals. And I've been encouraged also, just in the conversations we've had in the work group meetings, about being able to talk with people in other disciplines about social determinants of health, because we know in order to address social determinants of health, we have to be talking about things like education policy, but we don't always have those skills within the School of Public Health, and I think already I can see the impact we could have if we were having, some of the conversations we're having just in these work groups, if we could be having those at a larger level within the university, we could really have a bigger impact. Anyone else want to say anything?
There's actually one over here first.
Okay. Stephen Bizura, and I want to suggest the university focus its mandate on education globally. And let me give you an example of what I mean. Yesterday I spent 2 hours with the pediatric resident global health pathway, and among the, as well as the Seattle-based residents, were 2 Kenyans there. And I presented the information that was on your first map, namely longevity outcomes around the world. Kenyans had no idea they were 153rd among nations, and the pediatric residents didn't know that there were 34 nations that lived longer, healthier lives. On Monday, I talked to medical students, the same thing. Nobody in this country realizes that we're dead first among rich nations. If we look at the Institute of Medicine's 2013 report titled U.S. Health and International Perspective, Shorter Lives, Poorer Health, it says everything. And what is the main thing that the Institute of Medicine's report says we need to do? Tell the people. Unless we tell the people that in this country we die younger than our counterparts in all other rich countries, we're not going to take any steps towards population health.
Thank you.
Theo Voss from the Institute of Health Metrics and Evaluation. I understand it's still early days, but everything I've heard so far and what I've seen in the survey that came around, apart from the single word disruptive, totally lacks inspiration. And I think what I tend to hear is, what are we doing? What can we do more of the same? Let's be nice to everyone and everyone's hobby horses and just list all of them. I don't think that is what is meant with this initiative. So I would strongly urge you to look for inspiration, to look for what can be disruptive and what can be a really big change from what we're doing currently.
I love how direct you are. What would inspire you? I know what inspires me, and I know what gets me going in that room, and that might not be reflective of everyone's perspective. But, race and equity, LGBT rights, that really gets me going, and I'm really passionate about that. So when I'm in that room, that's certain groups that I'm advocating for and how we can engage. I'm not sure what inspires you, and I'm not sure if it's represented on the panel. So if you could share, I would love to hear it. But I love how blunt you are. That's good to know.
So actually, Theo, I am really glad you said that, because I think that we do need to focus very quickly and much more aggressively beyond the low-hanging fruit. There is a tendency, as somebody said earlier, to want to try to have some early successes, and I think that's what you're seeing here. But absolutely, unless we can convey that this is an opportunity to do something radically different, then who cares? So what? So I do agree with what you said. And if you can help us, I think what Eric is saying, if you can help us think about that, that would be great. There have been some really innovative ideas that are beginning to bubble up, both on the training side, since, some would argue that the current model for higher education is seriously broken in this country, and we should be thinking in new directions anyway, particularly across disciplines and across domains, and also on the research side. But that's what we're looking for.
Well, one suggestion would be to not have any meeting that's within a small part of what this initiative should be taking on us. So I don't think we could have had a meeting like this with just public health people, because we'll just repeat all the same things that we always tell each other. If you want to be inspirational, then pick up on the theme of collaboration with unusual partners.
Yes.
You tend not to talk to as an idea.
The strange bedfellow approach.
Yes, and those, we are having those conversations, and I think the more we hear from our constituencies that that's supported, the more that we can advocate. But I would say there are many people on the executive council that feel that way. Yeah.
And just to kind of give you a little bit of perspective on it, thinking about inclusion and exclusion criteria for projects, we're like, do we need to have... So thinking about inclusion and exclusion criteria for projects, the committee was thinking, should we require that 3 different disciplines are required to be on a project? How can we, reach across and engage people? So we're trying. And I think that we're planning on having a school-wide forum or something along those lines, but I believe, this was just part of the dean's address. So can you speak to a larger forum?
I can just give you an example. So Foster School of Business asked if can we pull together a group of business faculty with folks from public health, from social work, from other disciplines to have exactly that conversation. So there's definitely an interest. It's a topic that we're talking about, and I appreciate you continuing to kind of beat that drum, because it is something we need to do.
2 things. There was a comment made earlier about the university looking inward. Yesterday I saw the results of a survey done at the University of California that found that 40% of the staff members experienced food insecurity in the last year. I would not be surprised if contingent faculty were included in that number. I think while the university is looking inward, they might look at the people who work for the university. The other thing, I was very struck by your maps as you focus closer and closer, that in the United States, which does very well, if you look at Appalachia, and particularly places like southern West Virginia, we do absolutely horribly. And if you focus it even more in King County, in southern King County, around Auburn, Pierce, Livonia, some terrible health outcomes there. And they're in a group that I think is, we sometimes ignore, which is people like me. Middle-aged white American males, we do terribly. And there's a lot of reasons for that, sociologically and otherwise. But in looking at populations, I would encourage you to look at all of the populations. Thank you.
Thank you.
Hi, Edmund Cito. First of all, a comment and then a question. First of all, the comment. I'm not really sure what the differentiation between population health is from public health. So I think many of us do cross-disciplinary, interdisciplinary work to try and reduce population health inequities around the world. I think if we look at kind of the work that we do, we all have that aspect. So I applaud the 3 of you for serving on the committee to help make that clear to the upper campus. That's the comment. The question is, I'm not really sure what the process is. You know, we submit ideas, and there's mention of projects. Is there actual funding involved in this? Is the university going to be chipping in resources to make these things real? Or are we just sort of patting ourselves on the back, like submitting, yes, we do population health research? So if you could speak to that question about resources and next steps, what happens to our things that we submit into this, that would be helpful.
To make sure those ideas don't just go into the abyss, you mean? So any ideas that are coming in, it's part of our fact-finding or listening to or getting a sense for what's out there. So everything that comes in is considered, and as we kind of work through these subgroups, figuring out how can we group them into certain themes to have more in-depth conversations. Is there other subject matter expertise we need to bring in to make sure that we have really strong conversations around these? In terms of your funding question, as has been pointed out by President Kause, we aren't the richest of universities, so there's not a ton of internal funding, but there is a commitment from the provost to fund some new faculty positions specific to population health. The exact details are still being worked through in terms of how many. Is it, for example, 3 years of startup funding, and then bridging to department support, kind of what exactly will it look like, but that is something that the provost is talking about. There's also been a talk of what can we do, is it whether it's potentially supporting grant writers, partnering with advancement, freeing up small pilot funds maybe internally to allow you to test ideas, come up with a proof of concept, and then pursue follow-on funding from a public funder. So those are all things we're working through. So I'm sorry, I don't have a specific number for you, but I can tell you that those are all questions that have come up at the highest levels, and it is something that they're very well aware of, that in order to do something, you're going to have to find a way to support it. So does that answer your question? Okay.
Couple of comments here. In terms of the difference between population health and public health, I think it's important to know that early on in the development of this discussion or this initiative, we talked about calling it public health. And frankly, if this had been, at this university, had been named global public health or public health, the concern was that this would have been seen as being the territory, the domain of a single school, this school. And the whole notion here is to break apart that silo and to have this be a university-wide initiative. And names matter. What you call things matter. So, yes, absolutely, public health is central to this. But it's not the exclusive owner of this, and this will fail if nobody but public health owns this. The notion is that this is an opportunity for us to work in a much more far-reaching way across this campus. So that's, part of where this came from. In terms of the money question, I'm really glad you brought that up. I have to tell you, in every subgroup I've participated in, this has come up. And my personal feeling is that unless this is resourced in a serious way, we will have trouble achieving what we're aspiring to. And it's important for us to be creative about the expanding the pool of resources. It can't just come from this university, but some of it does have to come from this university. And I think that message needs to be heard loud and clear. And if others feel that way, I think, you should communicate that.
I think one of the other things to think about is what barriers do we have that could be addressed by things other than money. I think, yes, resources are also important, but some of the things that we're thinking about is what prevents us from collaborating because of an institutional policy or because of a lack of infrastructure or because we just can't get people together, the right people together And so we're trying to think also about how infrastructure can be used, and there are apparently some other models on campus of how incubator programs or other programs have been successful in launching things. So solutions in addition to money, I think those ideas would be appreciated as well.
Okay. So we're really extremely grateful to these 4 people, to Derek and Judy and India and Eric for fielding your questions. And we've had some great questions. You've all challenged us, which is fantastic. And we look forward to having a real town hall, state of the school, in as near future as we can manage. Thank you all so much for coming. There is a reception downstairs in the lobby. Thank you to our faculty, our staff, our students who've come, our alumni, our retired faculty, our emeritus faculty, and our founding faculty. Thank you so much for coming.